go. Now I'll make you host.
I have to stop chewing before you.
Oh, it's a bit late.
Recording. It's morning in Denmark, so it's my breakfast.
Well, shall we start? I don't know if we'll get anyone else.
Good idea.
So I've only got a small group tonight. Is it Rainier or Rainier? I don't know.
No.
All right. I don't know if you're interested in my PowerPoint though, Randy.
Sure I am.
We can ask some deep questions.
Yeah. Rainier, have you got your microphone on?
It's not. They're not on mute.
I think. Rainier, whereabouts are you from? Which country? Maybe she can't or he can't hear us. All right, I'll start my PowerPoint then.
That's a good idea.
So I click share screen. Sound. This one. Can you see that?
Yes.
Okay. All right.
You can make it into a
into a slideshow.
Yes, absolutely.
I can't see if anybody else is trying to log on while I've got this up though.
I will look for that.
Okay. Oh, no. No, it's not doing power. It's not doing the slideshow. I'll have to swap my screens, I think. Okay. When I put it on slideshow, it's showing up on my other screen, but not on this one.
So have you at the bottom right where it kind of you can sort of see a percentage? Yeah, that little button.
Yeah.
To the left of that, just ever so slightly left. And that one.
That one?
Slideshow, hit that.
Yeah, but it's on. I've got two screens and it's on my other screen.
Oh, okay.
Screen. So we'll have to just look at it like this, I guess.
It's okay, no problem.
Yep. All right. Feel funny talking to just 3 people.
Well, when we've recorded it, we'll forward it to everybody else.
We will, and they'll love it. Then they'll be very sorry that they missed it. All right. So tonight I'm just talking to our patients about sex and sexuality because it's something that we don't do very well. Oh, you can't see my little man. When I click on him, he spins around. So just pretend he's having a spin around. So before we start talking to people about sex, we need to have a bit of an understanding of what sex is. So there's more to sex than just the gender. So you're male or female, and I'll just leave it at male or female. We'll talk about all the rest of them in a minute. And it's also more than just a physical act of having sex. People identify and display their sexuality in a whole range of ways. So it's how we present ourselves, our own body image, what we wear, the things we do, our feelings, emotions, beliefs, and values. And there's a whole range of different labels, I guess you could call it, for different types of sexuality. So we've got the LGBTQIAPK, and I did this a few years ago, so it's probably different again now. But that one covers lesbian, gay, bisexual, transgender, queer, intersexual, asexual, pansexual, polygamous or polygamous, and kinkiness, so that there is a lot more than just those ones. Sex, so we've got gender, we've got sexuality, and sex itself is usually a physical act between one, two or more people. They may be the same or different gender, and it might be an intimate experience or not. It might just be a physical act. The sex itself is an expression of someone's sexuality. Sex is a very complex topic. We have the physical side. The sexual function is controlled by the central nervous system, and that involves the brain and the spinal cord. The sexual arousal pathways will involve reflexes with direct stimulation of genitals or other areas, and the psychogenic side, so thinking, hearing, seeing, smelling something, dreaming of something. The effects of sexual arousal for men is an erection usually, and for women is vaginal lubrication and swelling of the clitoris. And a spinal cord injury can affect these central nervous system pathways and the person's physical response to arousal. So it's psychological and emotional, the responses. Body image is a very key area on how people see themselves and experience themselves, and it's an important part of sexuality and self-esteem. After a spinal cord injury, some people might view themselves differently, and I think the eLearn site was very good looking at that, talking about people's roles as a husband or a wife or a parent, a brother or a sister, where they work, how they work. Some people may have altered perceptions of their self-image and a lower self-esteem, and this may impact on their ability to engage in fulfilling, healthy and satisfying sex life. All of our clients should be provided with opportunities, encouragement and support to discuss sex and to discuss their feelings and their relationships. And is there sex after a spinal cord injury? Yes, there is. Men can have an erection. Men and women can have an orgasm. About 50% of men and women with a spinal cord injury can achieve orgasm. Men can ejaculate. Women can get pregnant. And definitely there can be long-term relationships. The physical experience of the sexual act might be different, but the emotions and the feelings will be the same or similar. And the myth is that it's not appropriate to discuss sex with healthcare workers, whereas the truth is it's a natural part of life. It deserves attention in rehabilitation programs. Sex and sexuality are health issues and they should be discussed. And that came from the PVA Yes You Can 4th edition. So when we want to talk to our patients about sex, and it could be they're bringing it up or we want to bring it up, a model that can be followed is the PLISSIT model. And that's a bit of a framework that you can use when you want to discuss sex with patients. And I'm not going to go into it in great detail, but you can look it up. So the P stands for permission, and that's giving the patient and the staff member permission to raise sexual concerns and ask questions. And that might be something as simple as, I think the eLearn brought up, if someone has man has an erection during a catheter change, it would be a good time to bring it up. Or just in general, when you're changing a catheter or managing someone's bowel care, just talking about those same areas, the same nerves can affect your sexual function and your sexual feeling that affect your bladder and bowel. Trying to use open questions, of course, as we do with anything, but it's just giving that person the permission that it's okay to ask questions. Providing limited information at a basic level, so it might be something very specific, and things about the what and the why. It might be, why can't I get an erection, or why am I dry when I have sex with my partner? So specific things that we can then answer. You could then move on to giving specific suggestions, things like maybe how to manage bowel and bladder during sexual activity, or what to do if you're getting autonomic dysreflexia during the act. So different specific things, and then knowing when to refer on for intensive therapy. For my staff at the moment, most of them would just be at the beginning level of where giving permission to themselves or the patient to ask, and then a lot of them would just be referring to someone else. So if all my staff can do is say to someone, I can't answer your question, it's not my area of expertise, but I will get someone else to come and speak to you. Or are you happy if I come back to with the doctor and we'll talk to you about it a bit more? Just so they know it's okay to ask the question, but don't try and answer it if you don't know. So when you're discussing sexuality with patients, it's really important to know your own comfort level, to look at your own values and beliefs. We would hope that all of our staff are able to put their own thoughts and feelings aside, but sometimes people can't. So it's important to be aware of that. And if you can't be comfortable in a conversation, then it's important to find someone who can. If you don't know answers to questions, then to be honest and find somebody who can answer them. And remembering too that all of our patients have very different life experiences, expectations and hopes. So we have patients from very young who may have had no sexual experience to the very old who still may have had none or who may be still very active. So it's just knowing the person, know when to refer and who to. So when to refer on to medical staff, and that might be for some medication, Viagra or similar. And I put on their Shine, which in South Australia is a sexual health network, and they do a lot of counselling and working with people. Again, knowing your patient and giving them permission to talk. Be informed about safety and health, about what the patient's likely to experience. Are they likely to get autonomic dysreflexia, understanding what that is, spasm and pain, and asking people to keep an eye on their skin as well. We had several years ago a patient who would leave the premises and go home, and she kept appearing with this nasty rash right across her sacral area. It was really bad. And in the end, we figured out with lots of digging that she was going home, her partner was getting her on the bed, and they were having a really lovely time, but there was a bit of moisture and friction going on, and so she was getting this nasty skin area. So once we knew what was going on, then we could give them some tips to manage that. It is hard for people to try and experiment or even have discussions in a busy ward environment. So if you are going to speak to people, trying to find somewhere safe and quiet, and maintaining your own boundaries and keeping yourself safe. So if something doesn't feel right, if you're the clinician speaking, if you're not comfortable, it doesn't feel right, then stop the conversation and get somebody else to take over. And we know that if you're having very intimate discussions with someone in an environment where you work closely and doing intimate personal care on people, it can be difficult for some people to maintain that professional boundary and not overstep the mark. So it's some of the concerns that people have. Will they be able to enjoy sex? Can they still have an orgasm? And how they're going to be able to satisfy their partner as well. And that's a bit of thinking outside the box sometimes. So using other parts of your body. What to do with a catheter? Can you still get pregnant? Yes, you can. Can you still get a sexually transmitted illness? Yes, you can. Working again, the bladder and bowel accidents, and they can be one of the biggest fears for people. So we advise to empty both before sexual activity if you possibly can. And again, talking to people about their body image, building confidence and self-esteem. So after spinal cord injury for a female, the female body can still have the physical act of sexual intercourse. That doesn't change after a spinal cord injury. But women can have varying degrees of loss of muscle control and sensation. So with reduced sensation, that can affect arousal and therefore reduce lubrication. That can result in injury of skin tissue, increased pain, spasm or autonomic dysreflexia. So suggestions that we can give to our female patients is there's some evidence that Viagra can help a little bit with that. doing a lot of foreplay, using sex toys or vibrators, focusing on areas above the level of spinal cord injury, which can be more pleasurable or they can be more painful, and to use lots of water-based lubricants. With reduced muscle control, there can be a problem with muscles being either floppy, tight, or having spasming. And again, that can be difficult or painful intercourse. It can be very difficult to position themselves. There's a risk of injury to themselves or their partner, and limited enjoyment and satisfaction of participants. So again, some suggestions would be find safe and satisfying positioning, and that might need some assistance from other people. Using pillows, soft supports, soft ties. I wouldn't recommend shackles, but some soft scarves or things to position. Use muscle tone. So if you've got the spasm, that can sometimes help with finding new positions. And medically, looking at medication to manage some of those concerns. Generally, fertility for women is not greatly affected by a spinal cord injury, but if there was a problem beforehand with fertility, that will still be there. Often menstruation will stop after spinal cord injury, and it's really important to discuss that with women because they may not be menstruating, but they could then ovulate. So there's a risk of them getting pregnant if they do engage in sexual intercourse without some kind of birth control before they get a period back. Following spinal cord injury, some of the general birth control methods need monitoring. The pill can increase risk of getting DVTs. Positioning of any intrauterine devices could be a problem if things slip or move. They have reduced or impaired sensation. And sometimes we will refer people to a gynecologist or women's health clinic for more detailed advice. During pregnancy, the women's likely to be seated a bit differently. So we would have them come in to our seating clinic for a review of their wheelchair and their cushioning. There is a risk of autonomic dysreflexia during labour and childbirth, and often they'll just be referred for specialist monitoring throughout their pregnancy. So for men with reduced sensation, if they've got reduced arousal and erection problems, they may find they can get an erection, but it's not very rigid and they can't maintain it long enough for sexual activity. So suggestions for men again would be foreplay, finding new zones that are pleasurable. We had a patient once who I'd only just started several years ago as a very new nurse, and this high-level patient that we had used to just love having the back of his head scratched. And it was only down the track a bit that I found out why he loved having the back of his head scratched. It was a very sexual zone for him. And another nurse found out it was somebody liking a cotton bud, just cleaning their ear. They were getting a sexual response from that. So different areas are very erogenous for some people. There are also different devices like vacuum devices, penile ring that can be used, but again, being very careful with something like that you don't cause skin damage. There are injections and implants and vibrators. We have the Ferticare and the Vibrect here that we use for men. And also worth just letting men know that if they do have an orgasm, their muscle tone could be floppier afterwards. So if they tend to use a bit of spasm to help themselves with transferring, that may be missing afterwards. And some men do use something like a Ferticare or Vibrect to have a regular orgasm weekly or twice weekly, because that helps keep some of their spasm down. With reduced muscle tone, again, men can find that their muscles are floppy or tight or spasming, and that again can result in difficulty positioning themselves. They may have a weaker hip movement. There's risk of injury and maybe not as much enjoyment and satisfaction. So same as with women, finding safe and satisfying positions, and they may need assistance with that. Using pillows and soft supports, soft ties. The intimate rider, that is the chair and the little bench up the top, and that chair actually kind of swings back and forth. Use their muscle tone to assist them with new positioning, and again looking at medication that they're taking to see if that's affecting anything. With ejaculation and fertility for men, they may be unable to ejaculate, or they may have a retrograde ejaculation. So suggestions are using vibro stimulation, so one of the vibrators, an electro ejaculator, or using a surgical method to retrieve sperm. Sperm quality, they get, oh, I lost my page. Getting a specimen and sending it off for analysis. Generally, the concentration would be within normal limits, but the motility of the sperm may be quite poor. And there has been some evidence that when they collect a specimen with vibratory collection, it's higher quality than either surgical or electro ejaculation. This was just something I came across and I thought it was wonderful. You've got Max and you've got Nora, and you can use them, I think it's like over a phone, a remote control thing from a distance to make them work. I would love to get some of those for the ward, but I can't get any money refunded if I buy something like that. But if you look them up, they there's some really nice clips, what you can see them moving. And again, just with our patients, when they're talking about sexuality and not knowing what to do, encouraging them to talk to their partner and talk about what they like and don't like, getting to know their partner all over again if they're already in a relationship, looking at sensitivity above the loss of sensation, experimenting with things, fantasy, using sexual devices, oils, lotions, and massage, and maintaining their safety, so psychological, medical safety, and their physical safety. And that's just a few different resources. So touching bases in New South Wales, for us, I don't know what's international, but touching base is sex workers who work with people with a disability. Sexy.me, I'm not sure if that website is still going or not. It's worth just typing it in and have a look. Scarlet Road, I've just put a picture there. It's a video of a sex worker from New South Wales, and it's really nice because it's got some of her clients in there with disabilities, but it also shows some of her work towards getting laws changed. She had gone overseas somewhere, so it's a really nice little movie to watch if you can get your hands on it. Looking up anything on YouTube, you just put spinal cord injury and sex in and a whole range of things can come up. The Paralysed Veteran Association guidelines. And then we've got, I'll put on there, sexuality after spinal cord injury, and that's a nice website, lots of little clips and mini movies. And I'll see if I can get the bottom one, this YouTube one, to play. And I don't think I can. I can't. No, but have a look, and when we've got this saved on the website, you can just copy that down. It's an American one, and it starts off with a young man talking about his spinal cord injury and what it meant to him from a sexual perspective. And it's quite funny, at one point his friends telling him, while he's there waiting for the ambulance from his injury, that it's okay, you've got an erection, you're going to be fine. And then he later realised, well, that's quite common for men to have an erection after a spinal cord injury. It doesn't mean they're going to be fine. And that's all I have. The sound's not working. But there was some lovely moans and things to that little slide. And then I had questions, but we don't have a lot of people.
I actually do have a question.
Yeah.
Just before, I was interested when you talked about fertility in women.
Yep.
I don't quite understand the physiology where she can still ovulate but not menstruate, is what I think you said.
So before she gets her first period for a woman.
Oh, this is okay. Sorry.
Yeah.
Okay.
So she'll ovulate before the period. So it just means that she may not know that she's fertile again if she hasn't had a period for a while, because that can stop for months afterwards. And if they're engaging in unprotected sex,
So
she could get pregnant. If she ovulates, she could get pregnant and not have a period still. Does that make sense?
Kind of. I just don't understand the physiology of why if you've had a spinal cord injury as a female, your period stops. Is that what I?
Yeah, and I don't know why that happens, but it's
Okay.
quite common. It's I don't know, the body in shock or something. I don't know why that happens, but we find it a lot. Yeah. And I don't know why. It's also, we find a lot of women, when they're getting their period, their bowels just go out of whack. I don't know if you find that, Randy. So their bowels are just not, they might have a really good routine, and that could be related to fluid retention and causing some incontinence problems. But yeah, we find that as well. But yeah, I don't know why their periods stop unless it is just an overall body going into shock kind of thing. But that could be one of the bonuses.
Yeah, well, one less thing to deal with, I guess.
Well, yeah. I have a question, because to my knowledge, there has been, well, the research that has been done around this area is mostly related to men. Do you think there's enough attention to women's sexuality after spinal cord injury, or
No,
maybe it's gotten better over the years? But
I don't think it has. There's a very big focus on men and getting an erection and ejaculating, and not much at all for women, and how to enhance their pleasure. So we can get the kind of medical grade Ferticare and vibroejaculators, but there's not something that I've seen that's a medical grade and that, you know, hospital could purchase for women to try. It's more go to a sex shop and see what you can find. And we have patients who'll do that. It just doesn't seem to be as important.
No, and I think, well, this topic, it could have been interesting to have lots of people from all around the world, because maybe for our countries it's more common or more natural to talk about sex than it is in some other countries, at least. So so maybe this is much more than their focus. Maybe some countries, they focus on getting pregnant and be able to becoming a parent.
Yep.
And how do we manage that? That would be the topic then about this.
The fertility.
Touch upon the fertility.
Yeah. So yeah, there is more related to the fertility than there is related to sexuality and sexual pleasure. That again, it's the taboo things to not talk about, really, isn't it?
I think even in Denmark, where this is something that we talk about in the public, I think there is a personal boundary for when to bring this topic forward, and thinking that, well, this won't be anything that the injured person would be considering right now. But I think, at least from my own experience, I've seen that people actually do think a lot about this, and definitely also if they can get pregnant. So it's difficult to know when the time is, but I think that you just put yourself out there as a nurse and say, if you find it right to talk about this, I will be listening. I will try to help you.
Yeah.
The questions.
Rainier, did you have anything you wanted to ask or comment? I can't see if you've got a microphone, if you're having trouble connecting with us at all.
I did message her in the chat. Rani is from Jordan.
I'm not sure why we didn't get more people. It's a bit unusual. Never mind.
It's usually a hot topic.
Yeah, exactly.
Like in stammer therapy, my God, it's like a packed audience.
Yeah. And it could be
watch
that,
it afterwards. Yeah.
Yeah, probably.
I know quite a few people did get the change of time because they'd seen it on the MOOC site, but maybe the people who wanted to attend will all turn up at some ungodly hour of the night and find that there's nothing.
Was that a question, Helen?
Yeah, the question was, can women with spinal cord injury above the level of T10 carry the pregnancy to term? And what are the complications that they will experience during pregnancy and delivery? Okay. So I think we touched on that a little bit with the PowerPoint. Yes, they can carry a pregnancy to term, but it is closely monitored and often monitored by specialists rather than the local GP. And it's the problems related to sitting, balance and pressure injuries or having fluid build up and causing problems, making their transfers more difficult because they've got this big belly in front of them to work around. And that was from Florence Malete, M-A-L-E-T-E. So thank you, Florence, if you watch this later. So I guess if we've got nothing else, we could have an early night. Rainier, thank you for joining us. I hope you enjoyed that or got something out of it. And feel free, if you want to comment anymore, just send it to our contact box tab on the MOOC page. And we've got one more Zoom meeting to go. That will be next week, and that's on pressure injury prevention. We're in week 5. We've still got 2 weeks that the MOOC will be open to complete the rest of the tasks that were on there and to do your final assessment and feedback. Otherwise, we'll say good night.
And thank you, Helen, for this presentation. It was very nice.
Thanks,
I hope everybody gets to see it. Yeah.
Yeah, it'll be up there. We'll keep an eye on who watches it. Thank you, Paris.
Thank you, Paris.
Steal you're muted.
So have a good evening. Have a good morning.
Yep, you too.
Thank you.
Bye.
Have a good evening. Bye-bye.